No one loves sitting in the doctor's waiting room, but imagine if your wait became an overnight event. That was almost the case for one Washington mother. She took her 4-month-old to an urgent care center after 6 p.m. The infant was suffering with viral type of symptoms. After an hour wait, the baby was checked in, taken to the room to check vitals. Nurse told Savannah, the mother, it would be about a 10-minute wait. Mother changed the baby's diaper, fed the baby, looked up, 30+ minutes had passed. Then mom's like, awfully quiet, pops the head out to ask how much longer the wait would be and realized that the clinic was closed.
Yes, yes.
And of course, panicked as the mother. You have a sick child, cried, called her mother-in-law to pick her up, had to trip an alarm to get people to figure out that she...
I guess housekeeping, the janitors that cleaned the place found them and had to...
We're able to help them get outside. Can you imagine that, though?
I have a confession to make, though. You know, this has almost happened at my office before. I mean, I think this can happen in a busy office when you have many office doors.
Like you were numbing somebody?
Yeah.
I said, you know what, a procedure you wanted to get back to?
Right, right, that can happen, certainly. You forget a patient in your lineup because you have a specific way of seeing patients. But I think sometimes there's a miscommunication. The patient might think you're coming back, but you've said goodbye to them. And so we always make a policy to open all the doors before we leave to make sure there's nobody left behind, because there have been times where somebody will peek out the door and I'll realize they've been waiting for a half an hour or 45 minutes, and I wasn't planning on going back there.
Thank goodness in this scenario that her baby wasn't gravely ill. And there they are waiting for hours, and that's the scary thing here, is that if you end up not getting the care you need, that could become a dangerous situation.
But I think there should just be a protocol in place that, you know, you check all the rooms before you leave. I mean, it's a simple thing to do. Somebody has the task of doing that, opening all the doors and making sure the rooms are clean, maybe before the end of the day.
And the other thing I will say, look, urgent care centers are popping up all over the country, and I think in many cases they can be a wonderful option. But the one fear I have with this growth of so many urgent care clinics is if people no longer have a relationship with their own primary care doctor, because the fact of the matter is a lot of the things that people go to urgent care for, they'll just get better on their own. And you can go, you get a treatment, maybe one that you may or may not need it, but then if people lose track of their health care very quickly. So that's the one thing, that lack of personal attention that can occur. And that's why I always tell people, no matter what, whether you're going to urgent care or an emergency department for an acute problem, make sure, if at all possible, you also have a primary care doctor who knows your medical history, knows everything about you. We did reach out to this particular clinic. They released a statement in regards to the situation, citing, "We are very sorry to learn that our patient and their mother were apparently left waiting as the clinic closed for the evening. We are investigating all circumstances surrounding this incident to ensure that it is never repeated. We are in contact with the family and have made arrangements to ensure that they receive the care called for." Luckily, again, seems like a fairly happy ending to this story.